agenda is for Ed Scudder's got the first four. Approve the service agreement with agencies for mental health and alcohol and substance abuse. There's a number of different organizations that we work with. Upstate Cerebral Palsy for $480,000. Neighborhood Center for $105,000. Cornell Cooperative Extension for $5,250. Herkimer County ARC $220,000. Catholic Charities $425,000, and Family Services for $155,000. Ed's asking us to approve this agreement from January 1st, 2012 to December 31st, 2013 for a period of 2 years. May I have a motion? Mr. Hendricks. Is there a second? Mrs. Medina. Is there any discussion? Mrs. Rose.
Mr. Chairman, can we just know how this amount relates to what it has in the previous contracts and any changes?
Well, first let me point out that the amounts we're asking for are for no more than the amounts that Mr. Smith read. There was some reduction from last year, Helen, specifically in one program that the UCP used to offer that was discontinued by the state. It was a screening program for kids in schools, and that was about $70,000. Catholic Charities lost $60,000 in what was a gambling prevention program that was discontinued by the state. And then Catholic Charities also discontinued providing a counseling service, which was $10,000.
What was counseling for what then?
Community, general kind of open family and children counseling. So all total, it was about $130,000, $140,000 less than we've had in prior years.
If I might, Mr. Chairman, the $10,000 for lack of counseling, they dropped it or the money was cut for it?
No, they couldn't recruit and retain counseling staff.
So how will we cover those services? Were they using the services?
People in the community were using it.
How will
sure.
we make up for that?
We'll do more.
Who'll do more? Your department?
Yeah, and I suppose the private people in the area.
This was a sliding scale access to services?
That's right.
And there's no place that we can make that up in any other provider?
No.
This money comes through, it passed through to us, or
Yes.
is it? No, none of this is local money.
No, it's all 100% state aid, and it's all advanced to us prior to our disbursement of it.
Thanks, sir.
So we get it before we give it. And if we don't get it,
You're one of the
we
last.
don't give it.
You're one of the last ones that still does that.
And the state has always been reliable on that.
No, absolutely.
They've never stiffed us in that.
It's been a while for most.
And their advance, we retain advances of many hundreds of thousands of dollars. So the county has it before we use it.
The gambling part of it, I mean, I watch the television, you see this one's been arrested for this one's been arrested for that,
Yeah.
for play to gambling. Was that highly utilized?
No,
Okay,
no, the state thought we needed it more than we did.
okay. Thanks, sir.
And what percent of these alcohol and substance abuse cases are repeats?
What they do is mostly prevention, mostly with kids. So they're not doing treatment with adults.
Okay.
So they're not seeing people in need of treatment, repeat customers.
All those in favor? Opposed? Carried. The second item is to approve an increase in psychiatric consultants and consulting counselors.
Asking for an increase of $2.50 an hour for our psychiatrist, our 3 psychiatrists, 3 part-time psychiatrists. We have one fellow comes in 3 days a week, one fellow comes in 2 days a week, and one doctor who's a child psychiatrist comes in 1 day a week. We didn't give an increase since 2010, so there was no increase last year. We're the lowest paid provider in Oneida, Herkimer, well, in the area. $122.50 an hour.
What is it, 122.50?
That's what I'm proposing.
For what professional? What profession?
Psychiatrist.
So this is just, but I thought there's more than just a psychiatrist.
Yes, there is. The other one, we have a part-time counselor, goes to jail, usually 2 mornings a week, 8 hours. part-time social worker that comes in usually 8 hours a week, sometimes 12, and a part-time nurse that comes in usually a day or 2 a week
To go where?
for the clinic. The social worker and the nurse come to the clinic, the counselor goes to the jail. I'm asking to give a $2 increase for them, and they haven't had a raise since 2009.
What percent is that?
You got me, Helen. 8%?
You're asking for an 8% increase?
Yeah.
6 point something then?
6 point something? Okay.
Last year, 2010 is when we gave them, the gentleman that we're talking about, a psychiatrist that went over to the jail, was a $5 an hour raise. We gave him back then.
Yeah.
Yeah, 'cause that was the sole no vote, I remember, because I still didn't think it was
I-
we weren't giving out raises for our people back then. I didn't want to give out a $5 raise back an hour. I
Okay.
thought it was high. And
But-
we're paying our attorney assigned counsels, they're getting $65 and $70 an hour.
These
Assigned
guys-
counsel, I'm just
You
saying,
can't find
know,
child
they're
psychiatrists, though.
These
professionals. I was
guys,
talking to Joe, I was talking to children, I was talking to all of the jail.
Well, this psychiatrist you're just talking about is the child psychiatrist, isn't it, or no?
and the adult, all of them, all equal. The child psychiatrists usually get more,
But the,
and they're rarer than attorneys.
So you're going across the board?
I'm not saying.
So you're going across the board, giving all the psychiatrists $2 an
there's
hour?
only two.
That's right.
No, not $2 an hour. Is it $2? It's not $2.
$2.50.
$2.50.
$2 for the others.
Wait a minute, I'm
Please,
confused.
please, one speak at a time.
Can he just go through the actual rates that we're doing for each of the positions, so we're clear?
The psychiatrist gets $120 an hour, Helen.
120.
I'm asking for a $2.50 per hour raise. And for the counselors, I'm asking for a $2 per hour raise.
What is their rate? What is their hourly?
They get $30 per hour, and I'm asking for a $2 increase.
Ed,
What about the
Excuse me.
nurse?
are you asking for this because they are asking for a raise, or are you just doing this because you're trying to keep us, the standard, with other psychiatrists? And are they from the Utica area, the Valley area, and who are they?
No, they're all from Utica, New Hartford. New Hartford and Clinton, John.
Who would they be, Ed?
Dan DiStefano,
That's a psychiatrist.
he's a child psychiatrist. Richard Zappa, who's a psychiatrist, and Vinay Patil, who's a psychiatrist. They're all very good. The reason they're with us is because we do a good job, and they can operate in a situation that's positive for them.
And you're asking for this raise for them because of why?
Well, we're asking because we haven't had one in a while, and we want to maintain ourselves as one of the lower paid places. So we want to keep pace, but we're still keeping pace with a lower wage per hour.
So what you're saying, Ed, is even with the $2.50 and the $2 an hour raise,
Right.
we're still lower than what the surrounding
Utica, they're paying
counties?
$135 to $150. To the neighborhood center and the upstate cerebral palsy.
Are they
And the
pay-
mental health connections.
Are they paying their malpractice like we are?
No,
So we're paying their malpractice?
no, no.
No? I thought we
No.
were.
No, I have a resolution to ask to pay for up to $1,500 for Dr. Patil, who's also providing services to the inmates. And that, I believe, goes above and beyond his service to the clinic or to the community.
Which we did with Dr. Menon too, right?
That's right, so I'm asking to continue it,
Otherwise, they carry their own malpractice?
yes.
The counselor rate, I just am curious, the nurse, $30 an hour is the going rate for a nurse too?
Well,
We're not paying that to our nurses, or are we, Jim?
Pretty close.
And we're gonna bring them to 32?
That's what I'm asking, Ellen. And this, again, there hasn't been a raise since 2009. I didn't remember when there was a last raise, but we looked it up because of the meeting.
Gary.
Where is the counselor and social worker from? Residency?
Well, they're from New Hartford. Two of them are from New Hartford, Frankfurt and New Hartford. And the guy goes to jail's from Downsville.
Is this the guy that used to work for us that we brought back?
Jeff Whittemore goes
Okay.
to jail.
That's a contract, he's a contractor.
That's
He's
one
not-
of the consultants, yes.
Did the
I-
psychiatrist now get travel time back and forth too?
We give one of the psychiatrists travel time,
Which one?
Dr. Patil.
The lead guy? Is he
Yes.
the,
She girl.
It's a, I thought it's a he.
Samantha?
Yeah,
The
used to be.
lady retired.
Yes, she retired.
Mr. Chairman, I just would like to know, I really would like to know what we're paying. We have social workers on staff and we have nurses on staff. I'd like to know what these wages compare to those that we're paying at a base rate.
They're not comparable to these.
Why?
Social workers and nurses on staff are,
Are not comparable to nurses like these nurses? Why?
Yeah,
what's
finally, Ellen, this of course is a straight rate without benefits and without taxes taken out. So I think without benefits and of course with taxes taken out, that lowers the effective rate to something lower.
I still would like to know how it compares, if I could have that
I'll do
before
it
we
before I
vote. Thanks,
leave.
then.
Well, our social workers, yeah, it's gonna be pretty close. I think about 50,000 a year, 52 now. The nurses our nurses are underpaid for our department, and I think they're getting about 34, and they've been with us a long time.
Underpaid is a statement of fact, or that's an opinion?
No, I think it's a statement of fact.
The average salary for a nurse is about 58 grand
On the outside?
on the outside.
Yep.
For our region.
Yeah, but we don't pay any of
No,
our
no, no,
nurses
no.
there.
They're just basically what Ed said, probably closer to 37, 38 with longevity and stuff.
all those in favor? Aye. Opposed?
Lenny and Jean.
I mean,
Number two?
Yeah,
you know, correct, it's 2 years. before that.
they both agreed to it.
Okay, the third one is reimbursement of malpractice for insurance for Dr. Patil.
And this is, once again, is, as we had done with Dr. Menon, who retired, is consideration for the services to the inmates, which I believe is above and beyond. It's a special hassle, and all of our psychiatrists have been sued for one reason or another by inmates in the past. So that's another benefit of providing services to the inmates. Another privilege.
Mr. Chairman,
Yes.
is he the only one that goes to the jail?
He's the only one providing services to the inmates.
Whittemore goes to the jail too, though, right?
Oh, yeah, Whittemore, everybody goes to the jail, or I go, Whittemore and 2 of my other guys,
And how
but he's the only psychiatrist.
How many stops on the weekend do you make?
Well, it
I think it's
depends.
good to update people.
Oh, once a month, once, twice a month. And it'll go and runs. We had a Christmas holiday special this year. So we were going a lot.
I just want to make sure people realize that some of our new guys that do that for us.
Inmates in our jail, there's no place to observe them when they require special observation. That is, when they say or when people believe they may be suicidal. Bigger facilities have better methods to observe. So if somebody who says they're suicidal, and they can say that for any reason, including to harass the staff have to watch them one-on-one until they're cleared by us to come off that special watch, or until they cry uncle. So there's concern, of course, that the inmates don't harm themselves, and there's concern that for the overtime and the staffing hassle it causes for the jail personnel. So,
Isn't there a camera that can go in there to watch that?
May
the
I
state, I believe, requires it, but
may I have a motion? Money? Second? Fred?
How much money is this, Mr. Chairman?
$1,500.
no more than.
Up to, right?
Up to, no more than.
All those in favor? Aye. Opposed? Carried. And now he has one more, authorized appointment of Dr. O'Keefe to the Community Service Board.
This is an item that, by prior resolution, we asked for approval by the Human Services Committee, so the chairman can then authorize the appointment to our board. We're nominating Dr. O'Keefe to be a member of the board. We happen to be required to have an MD on the board, so this is the first time we'll have that for quite a long time.
How long is the term?
4 years?
Money? Someone else?
Second.
Jean?
4 years?
Such great something.
Anyone else want to speak? All those in favor?
Aye.
Opposed? Carried. I guess that takes care of you.
Thanks, everybody, and nice to meet
Nice
you.
meeting you.
Ed, can you send it, Doc?
I will.
Please.
Thanks.
Have a good evening.
Yeah,
Thank
take care.
you. You too.
God bless your wife.
Hey, Don.
Hey, Doc.
Oh, you're deaf.
Jack, the first one is with Herkimer County.
Okay. Utica College Public Health Nursing.
This is a educational opportunity for students at Utica College in the nursing program to have a experience at public health with our nurses. They've had a contract since many years, and this is a 2-year renewal. It was a resolution a few years ago, which...
Yeah, it was Resolution 252 of the year 2009.
So, it's just a routine.
All right. Is there any well, first I need a motion.
I'll make a motion.
Gene? Second. And Jimmy? Is there any discussion? Mrs. Drumm?
Just, do we get remitted tuition on that or anything for them being here? We talked about that. Do they get, I know they give it to other places.
Traditionally, in the medical field, unless there's a special deal like between hospitals, but even there, almost all of these programs where students have a short experience is done without charge.
How short is it?
These gals come, I think, for a morning or a day for several months, and they follow around.
I know we used to get it, Psych Center, we used to get it for this, when they would do a rotation through from NDCC and all, I was just curious.
They do no, these particular students in this particular program do no hands-on.
We were just talking about malpractice, there's no issue there with insurance or anything.
No,
Do they
So-
provide us insurance coverage though? in case
yes, they do provide their own coverage.
So it's all observing, right?
Entirely observing, interviewing us, and, we actually hope that maybe sometime one of them would be a candidate to work for us as a nurse.
3 inches.
All those in favor?
Aye.
Opposed? Carried. Okay, Doc also is asking to authorize a temporary position for a senior clerk in public health nursing service.
This is a different request from last year, but we had a Medicare clerk who retired, who has been able to master the Medicare billing. This is entirely for billing for flu shots. For us, the flu shot program is a small income producer, but for the flu shots that we do provide to the senior community especially, it represents in years gone by $50,000 or $60,000, but now the pharmacies are providing flu shots, it's gone down to probably $30,000. And the reason that a part-time clerk for this program is, one reason is that in the past 2 years, it's taken almost 2 years for Medicare to finally agree on what they're going to pay and what code they're going to use and so on. It's required multiple resubmissions. And last year, we had this clerk do this and spend part of $5,000, but not all of $5,000, getting this money to us.
How long is the position for? You say temporary?
I put in for the period of the year, just in anticipation of the fact that Medicare changes the rules constantly in the codes, and she only pops in if there's something she has to do to.
Is this a retired person?
This is a retired
Is it,
person.
Dr. Chairman, if I might ask a question on this, is this, I understand that we're behind on Medicare billings, are we current, and that there's possibility we could lose the money because we've got to appeal to get the money, $30,000?
That's sort of the nature of the whole Medicare process, is appeal and reappeal and just its persistence. And, that was one of the difficulties in training personnel to do the job, was that it just requires a lot of tenacity. And so, Medicare just puts a roadblock, and you've got to wait until they lift the roadblock.
Doctor, as I understand, so the person that's coming, that you're proposing to do is the person that has retired and is the one that's doing it, really not training anyone, she's the one that's doing it, is it she?
Yes.
She's doing it, and that person is available to us, or is she leaving? The concern I have, I'll just be very straight with it, is that supposedly, as I, again, third party, the system was down, we weren't able to bill. When we did bill, Medicare rejected it because it was late. An appeal had to go in to say, well, it was down, but our deadline for appealing is lapsing or lapsed, and that the person that you're bringing back is going on vacation and will be gone. And, this is scuttlebutt, and I'm just very concerned that we not jeopardize $20,000 or $30,000. It's great to bring someone in here from retired, but I know people who are retired like to be able to take off and go on vacation when they're retired, and if the person that you're proposing in this is not available to us, who's going to do this billing and make sure we don't lose that money?
I believe that she's available to do it within the parameters that we have and the timeframes that we have.
What is that? What timeframes do we have?
Medicare is certainly obstructive and delaying, but they respond to the request for an extension, and they've delayed us for over a year in these things, and so they're amenable to, reasonable requests.
So your view is that nothing's in jeopardy, no funds are jeopardized, and the staff person is available to come right now and catch us up or whatever?
Actually, she's up to date on what she can be, and when she returns from her vacation, which we've checked, she should be okay on getting those funds.
Gary, go ahead.
Are we cross-training anyone? So, because obviously this retired person won't be around forever. Is there somebody in the office that can...
It's only for a year.
I know, but, a year down the road, is somebody going to be trained?
This is a temporary position authorized for up to 250 hours.
Yeah, I understand that. I was talking about
Hourly
training.
cost of $17.36 per hour, with a duration of authorization from 1/1/2012 to 12/31/2012.
Well, how long did we do it
The
before that?
maximum expenditure would be $4,365.
We've already done this, though, Mr. Chairman.
Doc,
This is
you want to talk about our discussion today?
Well, there are other possibilities, and in terms of the cross-training. First, we attempted the cross-training last year. It's very complicated, the Medicare training, and for the small amount of billing that we do, it's like training someone to be a psychiatrist for 1 hour a week. Very expensive and difficult training.
$22.50.
Look at the money you're saving.
Now they should understand from that. But at any rate, so to be honest, the training was not successful for the cross-training. And so we're very hopeful that other departments that bill Medicare also within the county can help us out with this. And so we're going to try to work with the other departments that bill Medicare to see if they can take over this. It's a small billing aspect. It's a small amount of work, and it's a moderate amount of money, but it's a small amount of work, and it's not really possible to find enough for one Medicare clerk to do. We do have one of our clerks who may also be trained for this.
So we're not offering benefits or nothing, it's just straight...
The person's retired.
Correct.
Okay.
Mr. Chairman, you made a statement, though, that if this was just going forward. We've been doing this for almost all of 2011, weren't we? With this person brought this retiree back at least half of it. I mean, this person has been around for more than just what we're looking forward. We got to look back and see how much we've done on it. And
Yeah, but cross-training for what was in the past, it's not gonna help us now.
Well, June, we said the cross-training didn't work. We're now January.
Yeah,
He just said that he's gonna work with another department and try to get help from another department to help with this, so.
Would that be within an overtime situation? Is it, Jim said you were
Well,
talking about it, or would it be just?
Mr. Chairman,
Yes.
Doc and I have had discussions with Ex-Cutter probably over the last year, I want to say. We've gone all the way to try to combining departments, just in financial departments, just didn't seem to be workable yet. Doc and I talked today, we're going to reapproach Ed to be able to take care of this on a daily basis. You know, maybe like Doc said, 1 or 2 hours a week.
To be absorbed, not as an overtime
We're
situation.
not, I'm not looking, Doc's not looking, I don't think Ed's looking for it to be an
Okay.
overtime situation.
Thank you.
But again, we hope to work that out as we move forward. But again, we thought this would be a short-term fix, and then the long-term would be for,
But I just want to go back to make certain that we're not
For mental.
jeopardizing any Medicare reimbursement. And I guess, Jim, you're up on what the problems
well,
are.
Doc and I talked about this, and I believe that we're okay.
Okay.
Well, we need to move. It's just like, he's had a lot of transition in his preschool program, and they busted their hump, and that was finalized a couple weeks ago. That was $1.4 million. So, with the turnover and stuff, you have somebody who's, it's tough when you lose those people. They're very good employees.
Yeah, I have a motion. Money?
Second.
All those in favor? Opposed? Thank you, sir. Okay. The other one, oh, he's got this one. The discussion regarding jobs.
Yeah,
Mr. Chairman,
I'll go forward, and then, please, Doc, jump in. Because it started for me. I was approached by At Home Care concerning their process. I think everybody here, you guys know, we decided, the legislature decided last year to sell the shop. That was sold to At Home Care, which is a subsidiary of Bassett, for $200,000, $50,000 up front, $100,000 after the completion of the paperwork with the state, which we guessed would be around August, September of this year, and then 1 year after that, it would be $50,000. Bassett is going through the process with this. I guess for Bassett to say that they were having extreme trouble tells you something how difficult the state can be to work with sometimes. And came to me and said, what do you think if we abandon the process? And also in the middle, I think I've shared with some of you guys what also happened at the state level on December 8th, that the commissioner promulgated some regulations saying that anybody can apply for a job within a community, which kind of changed the rules of the game. So when that happened, I think Bassett took a look at that, At Home Care took a look at that, and basically thought it was the best way forward to work this process through was to have basically the county transfer the patients that we have. I think we're 8 or 9, Doc, at that time, and that once we got down to 1, we could apply to the state to close. Once we closed, we figured, let's say that letter went in February, it would get on the March meeting for the state council, and hopefully the state council would say yes to that. They said to me...
Who's they?
Oh, crap. Lori...
Just what office, Jim?
Lori Neander, I'm sorry, I apologize. I drew a blank.
At Home Care?
Yeah, At Home Care. She runs At Home Care. She committed, and I take her at her word, no writing, that once it's closed, the day it's closed, $150,000 would come to the county. So I was looking at it as a positive since we had made that decision anyway. And the fact that they looked like to do that. In the meantime, I gave Doc a call and said, Doc, this is what's going on. What do you think? Is it possible? We had our state rep left. In the meantime, a new gentleman came over the last couple months. Not the same experience, I would say. Doc and this gentleman had a discussion. He didn't think it was doable.
What was doable?
what we were talking about. He didn't think it was the way to go, didn't think it was doable. However, Doc and Lori went back to this gentleman, had discussions with him, and I think since then he's concurred that, this is a doable way to go.
How timely was those discussions that you're just talking about took place? When was
Like I
that?
mentioned earlier, Helen, it was very late December when we started the first discussion. And then it was early January that we had subsequent, and then probably about 2 weeks later, we felt comfortable. I felt comfortable with where we could go. The process and the part of where I probably misconstrued what should happen is the fact that we needed to get down to the one patient. To do that, Doc was working with visiting nurses and with Bassett to offer the 8 individuals who were still with us, either go with visiting nurses or to be able to go with Bassett.
Are those the only two choices? Why are those the only two choices?
Well, Visiting Nurse Association of Oneida and Oneida County has a long-term care license, and they were also one of the applicants for purchasing our long-term care license last year. And they continue to have an interest in providing long-term care services as well as child services within Herkimer County.
And Doc, I apologize, I think I misspoke. Bassett does not have a long-term.
And this was the gap in their privileges, was the long-term care license within Herkimer County. The long-term care program has very complicated structure. What Mr. Wallace alluded to was that the commissioner and the governor's Medicaid reform proposal turned this whole process upside down by, number one, allowing relaxation moratorium on child licenses, but also that all of the long-term care licensure had to be under a Medicaid managed care program, which also was such a huge structure to develop that, and it was designed more for the New York City market, that it really, I think, I watched the webinar on how that process had to come about, and it was daunting. And I think it was daunting for anyone who watched it. And it turns out BNA has that kind of capability already, so I think they're very interested in providing services to our patients. However, patients can't just go on to a CHA for long-term care because of the Medicaid insurance model, and one option for them is to go to another home agency that has long-term care license. Another option is to go into a nursing home, and another is a new program the state has called a Transition and Diversion Waiver Program, for which the backlog is very slow. And so the director of that program is coming down on February 2nd to review all the cases with us to see which of our cases would be eligible for that. So there's a lot to this. The situation's been very fluid, as Mr. Wallace said, and it took quite a while for it to be clear that we could even make this change. And so the middle of the month, we had to submit an entirely new closure plan to the state, which hasn't been approved.
We submitted a closure plan?
A revision of our closure plan.
Our
from last
original
summer.
closure plan was to close and transfer to, okay, so what's the new closure plan say?
To close.
That's already gone in?
That's
Okay.
gone in. Since there is no one with an application to take this agency.
So what are they paying for? I'm sorry.
Yeah, that's what I was gonna ask, Doc, you seem like you're up to speed on the whole, why would they give us that money? I mean, there's gotta be a,
I don't want to get Doc involved, I was the one that talked with Lori.
okay.
Doc wasn't here that day.
Okay. Well, I was just curious if you knew why there might be alternative reason why they're offering $150,000 for something that they just don't walk away from.
The only thing I was told when I talked with Lori was that they felt they had made a deal and that they wanted to.
So they're gonna honor, okay, that's
But
fine.
what's in it for them? If they're not even the licensed agency, and Superior Home is already the licensed agency for those services.
Doc, can you speak to that?
Say credibility.
I was gonna
Right.
say, I think they just felt that, you know, we put them on the front burner and we had other opportunities maybe or whatever they.
Well,
and
Streck
just
is the
being
head of this.
reputable and.
Yeah, but Streck is the head of this whole thing that did all this. The head of Bassett is the guy that's the head of the commission or whatever the panel is that
I know
put
him
these
very well.
rules. He's the head of the commission, isn't he?
What do we complain about? Take it.
No, I'm just kinda
No,
curious.
it just doesn't make sense.
I mean, I'm just kinda curious if there's something.
Doesn't make sense that somebody's gonna hand away $200,000.
Gary,
To get back to this,
Gary wants to talk.
to get back to this commissioner's recommendation, Mr. Wallace was kind enough to send me this memo from the planning council's meeting that the determination of public need was brought up in this regulation as opening up the process. I'm still digging into all this language. But I did call the Department of Health and speak to someone that worked in the health department writing regulations. And the individual that used to work there looked on the website where his regulations used to go. And every one of these other ones seemed to have passed with the exception of this emergency action, which usually goes on the fast track. So I guess my question is did it actually pass? Because it doesn't look like it did. And if it did pass under emergency action, I'm told they still got to go through a process, like a 30 or 60-day public comment period. And it doesn't look like it's gotten anywhere, other than being on this meeting agenda. Are we sure this regulation was enacted?
I don't know, but the last, I was at the county, inter-county, it was said that at that time it hadn't passed, right? But they
I was
were,
told it only had to
they
be
were worried
published.
about it. Have you heard any?
It passed at the meeting in December that was proposed. And actually, each one of those meetings, that public health and hospital planning committees is the most powerful organization in health in New York State. And that emergency regulation procedure that they go through there, many people question, you know, how come this is such a big emergency? But that's the way they do it, and that analysis that you read there with the different, you know, on rural areas and visual damage and so on, is the process they go through. And so that passed, and they have a period of time to wait for it to go into effect, which perhaps is ending soon, but there was a recent meeting. Department of Health had a meeting where they explained what they anticipated would happen in terms of their, with the regulations and so on, and so it does appear that this is all going into effect just as that regulation.
But it just appears to me, and I'm a novice at this, and I expect a call from the Department of Health tomorrow, that this was the only regulation in this meeting that just doesn't appear on their site or in other places where it's disseminated. And it just seems kind of odd.
This is the regulation about other CHAs being able to come into the county. I thought it had, all that was left when I checked on it was it had to be published. And it was so many days after its publication, it's published on
That's my
Wednesdays.
understanding also.
But also the reading on that I was given was that it's still a 90-day kind of thing, and then it has to be, it has to then become made permanent. I mean, it's in effect. The ability to do that is for 90 days, and then it has to be, some action has to be taken by that very powerful council that the head of Bassett is the head of. I guess, for me, I'm interested in knowing, who's it, Superior? Who's the other one?
No, the visiting.
Visiting. Who else has licenses that could come into the long-term that bid on this thing?
None of them.
None of them.
None of them except DNA, and applied last year. HCR, wanted to apply
So,
analogously, as did Superior, to what Bassett did for both.
our closure plan then would be that any of the, if approved, any of the people that we have in our program now would transfer to visiting nurses? I thought you said, and somebody would go to Bassett.
The original plan, as approved by the state, would give, closure would give patients the same option they have now, which is to any available agency that has a license, which at that point would have been at-home care. Now, it includes DNA, but it also includes something called CHC down in Montgomery County, also has that long-term licensure. And so among the, one of the emergency possibilities for any home agency that's closing is that because they have the strict boundary lines with counties, the commissioner, through his central office, can authorize these neighboring agencies to serve patients within our county.
Does the patient have a pick who I want to go to?
The patient has a choice.
Who networks that for them?
We do. We provide them with all the choices that they have, and, you know, as I said, because of the structure of the insurance, their choices become somewhat limited, are somewhat limited, and so we try to help them in every way we can. That's part of the plan.
Is this closure plan subject to public referendum? Is that what they're doing? They're going through a period of time to allow the public to complain, and if there's enough complaints, it would be put on a referendum or something?
The action of the legislature, you know, established that you decided to close your agency for which you had the licensure. The Department of Health, acting for people in the state, determined if they thought that people's interest was taken good care of. And then the approval by the Public Health and Planning Council of the actual closure plan, which means that everything is ready and now we can do it, only says that after that happens, can we even talk about it with our patients. So, believe it or not, I mean, even though we aren't talking about this with our patients yet because it hasn't been approved that we can talk about it with our patients by the state.
Did we tell our staff not to talk to patients about it? When you talk to them?
Well, I mean, our staff has to know basically what's up, but our staff can't speak to, because of the rules of the closure, they cannot speak to they've been asked not to speak to the patients to get them all worried.
For sure, I appreciate it. So we have asked the staff, not advised the staff of that.
So do we, excuse me, I mean, we're taping this. What if a patient sees this? We're talking about it.
Yeah.
We're not talking to the patient about it.
That goes on the internet. Patient can possibly see that,
Or a family member.
or a family member.
Well, then maybe we should send a letter to the patients that we're covering,
You can't do that.
to the family. No, to say that, well, do they know that you were working to transfer everything to at-home care?
No,
Well, that was all in the paper, that you were gonna do that.
not from us, they don't.
Well, they know it from the newspaper, they know it from meetings, that was on the internet, your contract to transfer it all.
But before any of this is done, though, Doc, we're gonna make sure that they're all taken care of, though.
Yes, we have a,
They have to be.
That's what we need to stress to the public. I mean, if we're.
Bottom line, the service is still provided, they get their pick of where they want to go, and we get 150 grand.
Right, right. I just want to make sure it isn't coming, there isn't no backlash, you know, somehow
Yeah.
coming back to the county, just so the public knows too.
The contract that we have with them, could Mr. Malone tell us if there, what, any teeth in the contract that require that they pay this kind of money? I just find it incredible that a corporation would hand out.
One into executive session for negotiations of a contract.
I'm not negotiating, I'm asking for a termination of what's in the contract, that's all.
If you want advice of counsel, you can.
No, I want you to tell me the verbiage that's in the contract. I don't want you to advise me or anything. I want you to tell me what the cancellation verbiage is in the contract.
Yeah, but you have to let me finish my sentence, please, and don't interrupt me. If you want the advice of counsel, then you can go into a private session at any time.
Is there a second to his motion? Fred?
Can I ask my question in open session, though, because that's not part of the private council, I mean,
Okay, ask
executive
your
session? I would like to know what the cancellation terms are with our contract with at-home care. What's the
Don't
contract
answer that.
stipulates?
No, that's something the committee wants to hear because that
Yeah.
should be done, that's advice the council should be done. in
That's
private
advice of
session.
council. Is the contract an open document?
All those in favor of going into executive session?
Oh, God.
Opposed? Carried.
The legislature allowing me to apply for this local government efficiency grant, which allows for personnel costs and other costs related to closing a CHOP, basically, and consolidation of staff as well as personnel costs during the transition. And the reason that this just happened to come along so beautifully is that perhaps there'll be greater costs in the vesting of the job than we originally planned. So I want permission from
How much is that for, do you know? Is
It's
there
up to 200,000.
Motion.
Second.
Second.
This,
Is there any discussion? Mrs.
is this, we've divested an awful lot already, right, in terms of staff and all. Is there a lot left to do?
The carrying on all the patients is costly, and we budgeted a certain amount of money for 6 months for this year of carrying on with the CHA and long-term care. Perhaps we'd have to carry on longer to complete the process. So this would allow us some of our expenses.
Can you go back, Doc, on any expenses?
Yes, back to, believe it or not, back to 2007.
Wow,
That's what I wanted.
that's the big piece.
That was shocking.
Well,
That changes things a lot.
Absolutely.
sweet.
Is there any discussion? All those in favor?
Aye.
Opposed? Carried. Thank you. That'll be on the agenda for February 15th, right?
Yes,
I'll send you that.
thanks, Doc.
That's okay.
No, that was worth it.
Okay.
Motion to go into executive session. Do we ask that to stay for this?
I have a second.